So the CVM-005 trial is a very interesting study that assesses a new chemical compound, and that is CVM-1118, which is a quinolone derivative that induces cell cycle arrest and apoptosis and inhibits vascular mimicry by targeting TRAP1. And TRAP1 is, or a heat shock protein 75. It's a member of the chaperone, mitochondrial chaperones family of the HSP90 family. And it is involved in the regulation of mitochondrial dynamics in cellular metabolisms and also in tumor angiogenesis. And TRAP1 is known to be overexpressed in different tumors. And this overexpression is associated with a more aggressive phenotype and poor prognosis. So by targeting TRAP1, CVM-1118 reduces succinate accumulation in the cell, and this leads to destabilization of HIF-1 alpha. And this drug is converted by the phosphorylation to CVM-1125, which is the main active metabolite. And this metabolite has shown really potent growth inhibitory and cytotoxic effects in a wide range of cancer cell lines at a nanomolar range. And so this study was a Phase IIa trial that assessed CVM-1118 orally administered at 200-300 milligrams BID. Any patient with G1, G2, GEP, or digestive or lung nets could be included. And the primary endpoint aimed to target a PFS of 8 months. Aiming to improve at least about 2.5 months versus the 3 to 5 months reported for placebo control arms of the seminal pivotal studies, randomized control trials that were conducted in different primary sites with different approved drugs. And they plan to accrue 33 patients. They presented data on 35 evaluable subjects from 43 enrolled ones, which were mostly, the majority, very fit, PS0 in 94%, mostly G2, 77%, and mostly digestive nets, only one lung net, and 63% were of pancreatic origin. And the median number of prior treatment lines in this patient population was 1, and ranging from 0 to 6, about 30 to 40% had received prior sunitinib or prior everolimus and or prior chemotherapy. And not very many prior PRT. This is a study conducted in Taiwan, so treatment patterns may differ a little bit from the Western countries. So the global results of the trial was a median progression-free survival of 10.5 months, which surpasses the target endpoint of 8 months. Although it is, of course, difficult to interpret in the context of, different primary sites and small numbers, but it did surpass the primary endpoint of the trial with the manageable toxicity. Apparently, no lethal deaths and 18% grade 3 for treatment-related AEs. And so it is an active drug. Although it is difficult to estimate due to the study design what's the magnitude of the benefit or the balance benefit risk. So I think it it would be good to try to increase maybe the number in specific cohorts by primary sites, have a little bit more solid data specific of each primary site, and maybe try to have real world, good, high quality real world data as controls rather than on these trials they used to, and of course the external validation in Western countries would be also interesting, and the exploration of biomarkers. But it's really very novel. It's a first-in-class TRAP1 inhibitor, and it's really interesting data that they are bringing, and completely new chemical compound to be developed in this field.